Hi, my name is Tori Martin, and I'm an occupational therapy student at the University of St. Augustine. Today, I will be discussing occupational therapy's role in transition services, specifically in the role of going from able-bodied to amputee. Occupational therapists play a key role in transition services across the lifespan. Since it is a holistic profession that puts emphasis on the client's wants and needs, it is important for occupational therapists to be knowledgeable about life transitions. So to begin, it is important to understand a little about transitions and transition services. A transition is a movement from one form or stage to another, and a transition service is a service or intervention that aids and guides the individual during this time of transition. It includes situational and environmental changes, such as a child transitioning from one grade to the next, or a young adult transitioning from high school to work, or even an older adult transitioning from a job to retirement. Transitions can also be focused on environments, for example, transitioning from living at home to living at college, or from living at home or owning a home to living in an assisted living or a skilled nursing facility. One research article explained, anticipating and preparing for the demands of new environments makes occupational therapy practitioners important contributors to the transition process. In this same article, they defined the role of occupational therapy and transitions throughout the lifespan by saying occupational therapy brings a number of strengths to transition preparation and the transition process, including a developmental approach. These developmental approaches include the concepts of self-determination, client-centered interventions, adaptation, problem-solving, and active participation in occupations. When a client is faced with new expectations, environments, and roles, it can be a confusing and even frustrating time. Often with these changes comes the inability to successfully complete tasks and new challenges to the way they previously performed the task. The concepts of preparing clients for transition by including these skill developmental milestones and practicing and engaging in occupations necessary to transition and to enhance their function in post-transition environments matches the long-standing practices of occupational therapy and the more recent AOTA Centennial Vision. And an occupational therapist have several abilities that contribute to their role in these transitions, including that they view independence as a set of skills. Instead of seeing it as a whole thing, they look at all the little pieces and parts that will make a client as independent as possible. They also anticipate the demands of the task and the environment so that they can adapt them properly or go ahead and warn the client up front and make them aware of what's about to happen or what could happen and to properly handle that and overcome any challenges they face. Since occupational therapists have a unique perspective and ability to observe, modify, and adapt tasks and environments in order to promote occupational performance and improve functional skills, they play a key role in transition services. One unique area that occupational therapists have a special role is in the transition from being able-bodied to disabled for individuals with limb loss. So the individual starts out being healthy and able-bodied, and then they first experience the loss of a limb, and then they have to transition again when they receive their prosthetic. So it's several transition phases through this process. So when it comes to transitioning to living without a limb, and then to living with a prosthetic, there are 4 key therapeutic phases that occupational therapists play a key role in. The first is acute phase. The second is the pre-prosthetic phase. The third is the basic prosthetic training phase. And the fourth is the advanced prosthetic training phase. We will cover these in more detail over the next few slides. The first phase is the acute phase. In this phase, the occupational therapist and the client work together to create goals and interventions. These should both be client-centered, making sure the occupations are meaningful to the client and always taking into consideration both the wants and needs of the client. In this phase, the occupational therapist will also address wound care, as we want to make sure the skin is healing properly and reduce any risk of infection. Range of motion is also considered in this phase, as the occupational therapist wants to make sure the client does not become stiff and can use the residual limb to complete task and occupations now as well as later to manipulate the prosthetic. Desensitization is another area covered in this phase, and this is just working with the client, and it could be focusing on phantom limb syndrome, getting used to the fact that the full limb is not there anymore and how to overcome this, as well as seeing what sensation they still have and making sure the client is safe and aware of what they can and cannot feel anymore. Pain control is addressed, as we want to make sure our clients are in as little to no pain as possible and proper ways to overcome and handle the pain that they do face. And in this phase is physiological support. They have undergone a major physical change, which can play a huge role with emotions and mental state. So it is important for the occupational therapy practitioner to address coping and just to make sure they stay aware of how the client is feeling and handling the situations and provide the support that they need. The next phase is the pre-prosthetic training phase. This is when the focus shifts more to the skills needed to accomplish meaningful occupations. So instead of finding the very basics to brush your teeth or get dressed, we want to focus on all of the skills necessary for meaningful occupations to the client. This is also when OTs begin to introduce adaptive equipment for completing different activities and occupations, and they begin preparing for fit and optimal use of a prosthetic. So this is including edema control, because if the limb is too swollen and they can't properly fit a prosthetic, or when they do fit it, it will not be the right size when the swelling does go down. More desensitization techniques are used just to increase the acceptance of the prosthetic when it's ready. Scar management is focused on because this could be painful or also affect the fit of the prosthetic. Non-invasive feedback for muscle control and instruction of body motions to operate prosthetics go hand in hand, because we want to begin preparing the client for how they can use the muscles that they have to move the arm or the leg that they are about to receive, and just how their body motions will affect what happens with the prosthetic. Next, we have the basic prosthetic training phase. So this is once they receive the prosthetic, they must learn to don and doff the prosthetic, so taking it on and off as independently as possible. They also want to work on a schedule for wearing the prosthetic. You have to ease into wearing it because the skin is still fresh and healing, so you want to make sure they're not creating any problems, and you want to wear it for short periods of time so that we can see how the skin is responding to the new materials being against it, and just overall use of the prosthetic. You also begin focusing on basic controls and how to use the prosthetic during daily living tasks. And again, now that they have transitioned from losing the limb to gaining a prosthetic, emotional support and coping is again super important. So this is a good point to connect them to others who have been through similar experiences and successfully met their goals and achieved a good quality of life with their new prosthetic. The final phase is the advanced prosthetic training phase. So now they have their prosthetic and they have learned the basic controls and the basics of using it. So we want to begin integrating the prosthetic into all occupations and activities and tasks that they do, including things such as childcare, home maintenance, work activities, driving, sports, and hobbies. We want them to see that they're not limited, but that they can still reach all of the goals that they had set before and do similar or the same activities. And it is important to note that work, sports, and driving are occupations that are influenced by and affected by more than just the individual with the limb loss. So for these areas, the client wants to return to work, but the occupational therapist may need to advocate for the client to educate the employer on the needs for the client, including adaptive equipment, modified tasks, or even a role change. The occupational therapist, the client, and the employer will all need to work together to make proper accommodations in order for the client to remain successful and to be an asset to the company. So in many cases, the occupational therapist will need to advocate to insurance companies for adaptive equipment, especially for driving and sports. The client should not be denied access to these occupations, and it is the role of the OT to help the client get the support and approval necessary to engage in these occupations. But throughout the whole thing, the occupational therapist really needs to make sure they're not only focused on the physical changes, but also the psychological challenges that the client is facing. It's important for them to incorporate coping and emotional regulation into interventions. So, one important quote about this is psychological adjustment depends on various factors: the individual's character and essence, the quality of the social support system available, sociocultural reactions to amputation, and the team's management of rehabilitation. Social, personal, and spiritual context may be significantly altered for those who have experienced amputation. Therefore, it is super important that in addition to the physical aspects, occupational therapists assist clients in developing coping strategies for them that are very individualized and work for the client. This includes connecting clients to individuals who have experienced similar things and support groups. It can also be important to provide psychological care and support for caregivers and to connect them to support groups as well, especially if the caregiver is a parent or a spouse, but all caregivers should be given the same opportunity and educational points that these parents and spouses are given. In summary, occupational therapists play a vital role in the rehabilitation process and the transition from an able-bodied individual to an individual with limb loss and then to an individual with a prosthetic. And throughout this whole process, desired outcomes include positive self-image for the individual both while with and without their prosthetic. We want them to be as independent as possible in all of their occupations and required roles and tasks. We also want them to be able to reintegrate into work, social, and leisure roles, and to have increased health and occupational performance. And finally, we want them to have an enhanced quality of life. Because individuals with limb loss are faced with a major transition, it is an important area for occupational therapists to play an active role. Occupational therapists are trained individuals who can help them transition to their new lifestyle, their new way of living, and to be as independent as possible. Here are the references used for this presentation. They include some great articles on the topic. So thank you for listening. I hope you enjoyed it.